So what is preceptorship all about? It's around that transition period from registered professional from student. And it's been identified that it can actually be quite challenging, and the government has recognised, and the Nursing and Midwifery Council and Royal College of Nursing, that students need support and guidance once they are newly qualified to enable bedding into the role, to feel that confident and competent. Health Education England 2009 set standards for preceptorship, identifying that all staff, not just nurses and midwives, but all allied health professionals as well, newly registrants, need a period of preceptorship. The period of preceptorship is usually 6 to 12 months, and when you go into your as employees in organisations, they will have a preceptorship programme available for you to start. So it's about supporting guidance in practice. It's a programme of education and activities, and it can vary in content and structure, and I'll talk about some of the differences that might be available in different organisations throughout the South West. It isn't mandatory training, and it isn't induction, and it isn't an additional training programme. It is a recognised programme of development for the newly qualified. It enables you to start feeling safe in practice as a registrant, and it's structured to develop your role. And it also is about socialisation into your new role, and it hopefully will increase job satisfaction, feel valued, make you feel valued and respected, and enables you to become an effective practitioner. Enhancing the quality of your learning and development enhances the quality of care given, and it also helps staff satisfaction, reduce sickness and absence, but also looking at people who may need extra support. All the organisations in the South West are committed to preceptorship and to developing their workforce using this model. Now, you'll be allocated a preceptor when you start. These are people who've been trained in mentorship or preceptorship, but the role is very different from the mentor role that you have been working with as a student. After all, at the end of the day, you're a registrant, and it's about developing, enabling your development rather than directing your development. So there is a road and a journey that you go on as a preceptee. It enables you to develop a repertoire of skills and tools to enable you to develop further and look further forward as well. So these are the common sort of things that happen within a programme. There's quite a range of things here, and some of these things you will have started to develop certainly from your point of entry as a student, but also as you progress through your course as a student, but it actually builds on that, and builds on it as the fact is you are now the registrant, accountable and responsible for that care. So as I said, it varies between programmes. There are a number of study sessions. Some of them are supernumerary status, that you're enabled time off of from the work area to develop yourself as a preceptee, but you will also have to undertake mandatory training, part and parcel of it. One of the biggest things you'll do is action learning, and it's reflecting and learning together with a group of people who are in the same boat as you, as newly qualified practitioners, facilitated by learning and development, and it works really quite well. The other things that might be included are developing skills, competencies, looking at things that happen within your organisation, learning about e-patient records, for example, how to understand the organisation in which you're working, understanding the team, and also some organisations offer accreditation of the preceptorship programme to enable you to gain 7 credits at master's level, but your employer will know all about how. You have study sessions and clinical training. You'll work with different professional groups, and there'll be catch-up days through the year so that you can build on your initial skills and develop further in your leadership roles. So the person who looks after you, we've talked about, is a preceptor. They will have undertaken a course. They're providing you feedback, being that role model, enabling you to discuss where you are, what you need to do, and how you're doing, and be a focal point for you for your development. So these are what you might need to be thinking about clearly when you develop, when you're new to an organisation, looking at goals. Nothing's very different from when you were a student. It's just looking at different aspects and different activities that you need to develop yourself as a newly registered nurse. So you're expected to be proactive, but they give you a framework in which to hang it on, to develop and apply those skills, and also how to be responsible for your own development and that of others. So when you're thinking about applying for jobs, but when you start as a preceptee, think about the organisation you're going into. Look at what the teams do. Familiarise yourself with your job. Seek help and support. Thinking about planning your period of preceptorship. Getting into a new role can be quite difficult, especially in times of staff shortages. And the other thing that really, really helps is being in touch with others who are new starters, especially through the action learning. So with every success we wish you once you qualify, enabling you to go into organisations, develop yourself through the preceptorship period of between 6 and 12 months, and to be successful in your ongoing roles.